Hello, my name is Marianne McMillan, and I am the Chief Commercial Officer of Diagnostic Incorporated Canada. I have the privilege today of introducing Dr. Michael Stacey. He is the founder and inventor of a biomarker-driven wound healing diagnostic. It will be the first of its kind worldwide. Dr. Michael Stacey currently is the Chief Medical Officer and Executive VP Academic at the Hamilton Health Sciences. He is also a professor at the McMaster University. Please join me in welcoming Dr. Michael Stacey. Hello, Michael.
Hi, Marianne.
Can you describe the technology for us?
Yes, so the technology is based on an identification that we had of a biomarker, and we have a reserve candidate biomarker that gives us a very accurate estimate of whether a wound is actually healing. What we're looking for investors to support is taking that from that identification through to developing a point of care test that can be used for treating patients.
Who would be the target patients that this diagnostic would apply?
Yes, so the key patients that this applies to are those with chronic wounds. The initial work we did was with venous leg ulcers. We've got a study about to get underway on patients with diabetic foot ulcers. We also see that in the future there is potential for using this for other chronic wounds and even acute wounds that have gone into a chronic non-healing phase.
May I ask how this is different than other technologies?
Yes, this is very different to anything else that's out there on the market. There are no other point of care tests that actually determine healing status. In fact, there are no tests looking at biochemical markers that actually tell you whether a wound is healing. Traditionally and currently, the only way you have of evaluating healing is to measure the wound using one of a number of technologies and then compare that to repeat measurements over a period of about 3 to 4 weeks. And there are various different imaging technologies that assist that process, but still are limited by that prolonged period of time. The key with this test is that right at the bedside with that patient, you can perform the test and you will know at that time whether the wound is healing or not. The key thing there is if it's not healing, that right then is the opportunity to change therapy to try and improve the healing process, rather than waiting 3 or 4 weeks and missing all of that time when you could have converted that wound from a non-healing to a healing wound.
Thank you, Michael. Would using this technology be opportunity for any specialty? What kind of specialists would use this in their practice?
Yes, so the technology really is for anybody looking after patients with chronic wounds, and that goes all the way from specialists, specialist physicians working in hospitals or working in specialty clinics, to nurses in the community looking after patients in their own homes, and even to those looking after patients in remote communities. So lots of opportunity there for all of those people to utilize this, and possibly ultimately even patients themselves.
Would a caregiver be able to, is it a simple enough technology that a caregiver would be able to take the test and be able to communicate that to a clinician when in the home?
Yes, so really this is the big advantage of this test. It doesn't need a specialist or a specialty clinic to be there with the patient. So a caregiver looking after the patient can do the test. If the wound is not healing, then they can consult with a specialist to determine what is the next treatment or therapy that you might move to convert that wound to a healing status. And I think one of the key opportunities for this is particularly those communities in remote areas or even patients who are socially isolated and can't get to specialty clinics, to be able to improve the care of the patients in those areas by assessing healing status and then communicating with a specialist or a specialty clinic.
And what is the size of the market in wound healing?
Yeah, so the size of the market and market research analysis that we have done, it's been estimated that the advanced wound care market by 2026 is about $18.2 billion. Other studies have actually estimated it even higher than that, as much as about $24 or $25 billion. And I think the other thing is to understand the numbers of patients potentially there, who may benefit from this. And if you look at the major Western markets of North America, Europe and Australia, on our estimates of very conservative prevalence, we're looking at about 4 million people at any one time. If you use other prevalence data, it could be as much as 10 times as high as that. So up to 40 million people at any one time, just in those locations, who would benefit from this type of an analysis.
And Michael, how would this technology compare or be more beneficial in current assessment practices?
Yes, so current assessment, as I said, does rely very much on evaluating the wound over a period of time, and there are some good imaging technologies that help with that, but there is nothing out there that actually can tell you right at that time whether the wound is healing or not. This is something as a clinician researcher I've been striving for all of my career, and we're really on the cusp of actually implementing this into clinical practice.
That's great. What are the next steps for you?
Yeah, so the next steps for us is we're looking at engaging investors to support the development of the point of care test. We have a company who we've been in negotiation with, and we're prepared to work with them. It takes about 12 months to take it from where we sit now to being able to take it to manufacture. So that's really the key thing we're looking at an investor to support. We'll also be embarking on the diabetic foot ulcer study that I mentioned, and again, we're looking at support for that.
Finally, Michael, tell us why you are so passionate to make this happen.
Yes, so I guess the reason for my passion is that this is something that I've been looking for, wanting most of my career, looking after patients with wounds, because you really want to know right at that time whether that wound's healing or not. And this is the first test that's actually going to enable clinicians to be able to determine that. And the key thing is that then enables you to move more quickly to a therapy that will improve the healing of that wound. Ultimately, I see that we will have additional point of care tests that will guide us as to what therapy we might use. But without doubt, this is a game changer for managing chronic wounds and moving towards what we're calling biomarker-directed chronic wound therapy.
Fabulous. Michael, we look forward to this passion becoming a reality, and that you will have a hand in impacting wound healing worldwide. Thank you very much.
Thank you very much, and we look forward to engaging with some investors to help this come to fruition.